Cancer can be really scary because it often feels completely out of our control. But what if you have more control over it than you think? More importantly, we want to help you understand what cancer is, how it develops, and the processes involved so that you can reduce your risk of ever getting it. Hello, everyone. Today, we're going to talk about 10 warning signs that might indicate cancer. First, let's try to understand what cancer is and how these cells differ from normal cells. A normal cell can turn on and off. It grows to a certain point and then stops. This is called regulated growth. Cancer cells, however, were once normal cells that lost the ability to turn off, leading to unregulated growth. This difference is a key characteristic of cancer cells. For example, if you cut your finger, your body creates new skin cells in precise layers, each with different functions. These cells are called differentiated because they develop from the same type of cell, a stem cell, into various types with specific purposes. Cancer cells, on the other hand, don't differentiate. They just keep making more copies of themselves, looking and acting the same. Normal cells follow the body's instructions and maintain order, while cancer cells ignore these signals due to mutations. A cancer cell is essentially a mutated cell that has undergone changes, causing it to grow uncontrollably. Now, let's see how cancer develops. It all starts with a mutation, which is a change in the DNA sequence. Your body makes about 1 million DNA changes per cell each day as part of daily operations. When cells replicate, this number skyrockets. You're making 400 billion new cells daily because old ones wear out and need replacement. Each new cell requires copying 6 billion base pairs of DNA, leading to about 120,000 mistakes per cell per day, or 48,000 trillion mistakes in total. Luckily, the body has mechanisms to handle these errors. The first line of defense is DNA repair, which fixes mistakes. This imperfection allows for genetic variation, essential for adaptation. However, some errors slip through. If DNA repair fails, the next step is apoptosis, or programmed cell death, which eliminates faulty cells. Most errors result in non-viable cells that die off. If apoptosis fails, a mutation can persist. The immune system, with T cells, macrophages, and phagocytes, then steps in to identify and destroy abnormal cells. If this defense also fails, a mutation can lead to precancer. Developing cancer requires two main factors: an initiator and a promoter. An initiator is a stressor that increases the rate and severity of mutations, such as chemicals in cigarette smoke, environmental toxins, ionizing radiation from excessive X-rays, or hormone imbalances. However, an initiator alone is not enough. A promoter is also needed to drive the process forward. Promoters provide the necessary conditions for cancer growth, like feeding the cancer or weakening the immune system. Even with both initiators and promoters, developing cancer takes time. The process involves many steps and usually takes a long time to become dangerous. All right, let's jump into the 10 warning signs of cancer. Number 1. Fatigue. Many things can cause fatigue. However, cancer is one of those causes, especially if the fatigue isn't relieved by sleep or rest, and it persists for over 6 months. This could be a problem because the growing cancer may be using up resources in your body, and your immune system is busy fighting it, creating a sort of internal battle that drains energy. But remember, most of the time, fatigue is caused by things like stress and poor nutrition. Number 2. Pain. Another warning sign to watch for is pain, such as headaches and back pain, especially if it's chronic and doesn't change with body positions. For example, with regular back pain, you can usually find a way to sit, lie down, or lean that reduces or relieves the pain. However, if the pain is caused by a space-occupying lesion, which is a growth putting pressure on something, you might not be able to find any position that offers relief. This could be a serious concern. Number 3. Lumps. This is one many people are aware of. Women are encouraged to regularly self-examine their breasts. Finding a lump could indicate a growth that might be cancer, but most of the time, it's a benign growth like a fibroadenoma or a cyst. It's important to note that breast cancer can also occur in men. While it's not as common as in women, it is still quite prevalent. Men should also be aware of any lumps or growths on their testicles, as these could be a sign of testicular cancer. Regular self-exams can help catch these issues early. Number 4. Blood in urine. This is never a good sign. It could indicate bladder cancer, kidney cancer, or prostate cancer in men. However, it's often less serious, such as a kidney stone or a urinary tract infection, which is the most common cause. It could also result from trauma, infection, or toxicity that inflames the tissue. Inflammation of any kind has a specific name ending in itis. For example, bladder inflammation is called cystitis, kidney inflammation is called glomerulonephritis, and prostate inflammation is called prostatitis. Number 5. Weight loss. As many as 40% of people newly diagnosed with cancer experience recent weight loss. This weight loss is typically rapid and unexplained, not due to an intentional diet. It often, but not always, comes with a loss of appetite because the body can't process food properly. In the later stages of cancer, there's a condition called cachexia, where the body wastes away severely. This occurs in up to 80% of late-stage cancer patients. To understand cancer promoters, consider how some cancers are detected through PET imaging, positron emission tomography. This technique uses radioactive sugar injected into the body. Tumors absorb much more sugar than normal cells, up to 20 times more, highlighting them on the scan. This is because cancer cells rely heavily on glycolysis, the process of breaking down sugar for energy, and are less efficient at burning fat and using oxygen. This insight suggests that diet plays a role in cancer development. For instance, sugar-heavy diets might fuel cancer growth, indicating that reducing sugar intake could be beneficial. Other cancer promoters include 1. Chemicals. These interfere with the body's defense and repair mechanisms. 2. Pathogens. Viruses, bacteria, and fungi can worsen cancer by exploiting a weakened immune system. 3. Stress. Chronic stress diverts the body's resources away from internal healing and weakens the immune system. Understanding these factors can help us take steps to reduce cancer risk by managing diet, avoiding harmful chemicals, maintaining good hygiene to ward off pathogens, and managing stress. Number 6. Fever. A persistent low-grade fever, not associated with a cold or flu, can be a sign of cancer, especially if it lasts for weeks. Early on, it might indicate a blood-borne cancer like lymphoma or leukemia. In later stages, it could suggest a different type of cancer. There's a common misconception that cancers develop quickly and are quickly fatal, but in reality, cancer typically takes a long time to progress. For example, pancreatic cancer is aggressive when diagnosed late, but it likely began many years earlier with a single mutation. It takes about 12 years for this mutation to develop into cancer, with additional mutations over about 7 years, leading to advanced stages capable of spreading, metastasis. This timeline suggests there's often a significant period, ranging from 10 to 40 years on average, between the initial mutation and when cancer becomes a serious health concern. This provides a window during which intervention or treatment could potentially be effective. Number 7. Skin changes. Here's another important sign to be aware of: changing moles. You can use the ABCDE method to check them. A for asymmetry. If one side of the mole is round and regular, but the other side looks different, that's a warning sign. B for border. If the edges of the mole are not smooth and become irregular, that's not good. C for color. If the color of the mole is uneven or spotty, That's a concern. Uniform color is a positive sign. D for diameter. If the mole is larger than a pencil eraser, it's something to watch out for. E for evolving. If the mole has been the same for many years but recently started changing, you should get it checked. Number 8. Changes in bowel habits. If you have diarrhea, constipation, blood in the stool, or black and tarry stools, along with abdominal pain or bloating, these could be signs of colon cancer or another type of cancer. Here's what to look out for. Blood in the stool. If you see blood in the toilet, the problem is likely close to the rectum. Black and tarry stool. This indicates that the problem is further up the digestive tract, giving the blood time to coagulate. However, these symptoms are very common and often result from less serious conditions. Don't jump to conclusions. Most of the time, issues like food intolerances, small intestine bacterial overgrowth, gut imbalances, leaky gut with inflammation, or ulcers can cause these symptoms. Number 9. Dysphagia. Dysphagia means having trouble swallowing. If you have this problem, it might mean you have esophageal cancer, thyroid cancer, vocal cord cancer, or throat cancer. These cancers can cause lumps that make swallowing harder, but most of the time, it's something less serious. It could be gastroesophageal reflux disease, GERD, which happens when stomach acid irritates your esophagus. Another possibility is a goiter, which is a non-cancerous enlargement of the thyroid gland due to a lack of iodine. This can also make swallowing difficult. Number 10. Chronic cough. A chronic cough, usually caused by smoking, can lead to lung cancer, but this doesn't happen overnight. Smokers may experience years of chronic cough, known as chronic bronchitis. This occurs as the inside membranes and cilia of their windpipes deteriorate due to smoke, irritation, and undergo progressive mutations. We have many warning signals, and it's wise to pay attention to them. Most coughing, however, especially if it doesn't last for months or years, is likely due to respiratory tract infections, like a cold or flu. Typically, these coughs should resolve in a few weeks, but sometimes you might have lingering infections where your body can't fully clear it, leaving you with an annoying cough for months. While it's important to take these symptoms seriously, it's also crucial not to feel powerless. By being aware and proactive, you can manage and address these health issues effectively. If you followed along this far, you likely agree that cancer can be terrible and can progress quickly in its advanced stages. However, we also have many years to prevent early cancers from becoming serious because our bodies have defenses. Our overall health and immune system are influenced by many factors, including structural, emotional, and chemical aspects. Here are some steps to help prevent cancer. 1. Stop feeding the cancer. Reduce sugar and carbs in your diet since they fuel cancer growth. 2. Reduce chemical exposure. Chemicals can interfere with the body's cleansing process, immunity, and liver function. 3. Improve immunity. Cutting out sugar already helps, but overall, focus on maintaining a strong immune system by balancing structural, emotional, and chemical factors. 4. Reduce stress. Stress hinders your body's internal focus and DNA repair. Reducing stress can improve your DNA repair mechanisms. 5. Breathing exercises and meditation. These can enhance your parasympathetic function, reduce stress, increase peripheral vasodilation, and improve tissue oxygenation. Cancer thrives in low oxygen environments, so improving oxygenation is beneficial. 6. Fasting. Intermittent fasting or occasional longer fasts can lower blood sugar, boost immunity, and increase autophagy, which is your body's way of cleaning out damaged cells. 7. Exercise. Regular physical activity enhances all bodily processes, improves DNA repair, and boosts oxygen circulation to tissues. By adopting these practices, you can significantly reduce the risk of developing serious cancers. These recommendations are basic and simple because the solutions are fundamental. Understanding why these measures matter can help you implement them more effectively. We often hear stories about someone being diagnosed with stage 4 pancreatic cancer and given only 3 to 6 months to live. These stories can make us feel powerless. However, it's important to see the bigger picture. Most cancers develop over 15 to 20 years, giving us plenty of time to take preventative measures by living a healthy life and balancing our structural, emotional, and chemical aspects. While no prevention method is guaranteed, maintaining a balanced lifestyle can significantly reduce your chances of getting such a diagnosis. Cancer takes a long time to develop and requires multiple mutations to become serious. Your body has numerous defenses and a lot of time to fight off abnormal cells if you support it properly. Additionally, no form of cancer is 100% lethal. Some may have very high mortality rates, but there's always a chance of spontaneous remission. These cases, where stage 4 cancer patients are given months to live but later become cancer-free, are often seen as unexplainable miracles. Instead of writing them off, we should study these individuals to understand what combination of lifestyle factors contributed to their recovery. By learning from their experiences, we can gain valuable insights into defeating cancer. If you enjoyed the video, please hit the like button and share this valuable information with others. It helps a lot. Don't forget to subscribe to our channel. Your support helps us grow and motivates us to create more videos like this. Remember to drop your thoughts in the comments section. Thanks for tuning in.